Following is not linked to the excess glucocorticoid. That means excess glucocorticoid is one type of the steroid. When there is excessive release or excessive secretion of the glucocorticoid or excessive external administration of the glucocorticoid, what will happen? Here the options which will not happen. Here the options are the osteonecrosis, osteoporosis, hypokalemia, hyponatremia, and growth retardation in case of the children. So first of all, the glucocorticoid is released from the zona fasciculata. It is the zona fasciculata of the adrenal gland, and among them about the 90% of the corticosteroid cortisol, it is bound to the protein and 10% active, and it also maintains the circadian rhythm. That means definitive type of day it increase in secretion, and it is the morning. So in the morning time the cortisol secretion is higher, and it is controlled by negative feedback mechanism by the ACTAs, which is secreted from the pituitary. Here some action of the cortisol. First of all, glycogenolysis, that means breakdown of glucose ester and increase the blood glucose level. Gluconeogenesis, that means formation of the glucose from non-carbohydrate source, so it also increase glucose. Protein catabolism, that means the breakdown of the muscle mass. For this condition, the upper limb and lower limb, they become thin. So protein catabolism, that means the protein ester also broke down. Then the lipolysis and increase the fatty acid level in the blood. Then stress response, it plays important role in the stress response. Also it acts as a inflammatory. And decrease protein in the bones and reduce bone mineral and bone protein density. Increase gastric acid secretion. When there is more gastric acid secretion, then peptic ulcer disease develop. Then increase neutrophil, platelet, and red blood cell. So neutrophil, red platelet, and red blood cell, they are increased in when there is excessive cortisol, and it also inhibit fibroblastic activity. So what are the adverse effect? Here the adverse effect, first of all, there may be thinning of the skin. So the skin become more thin. Osteonecrosis, osteoporosis, because from here the calcium and protein, they are removed from the bones by this excessive level of the glucocorticoid. And the steroid are associated with retention of the sodium. This is very important, that the glucocorticoid or corticosteroid or cortisol, it has mineralocorticoid activity like aldosterone like activity. For this condition, it reabsorb sodium, and it also reabsorb water in the blood vessel. And also potassium loss occurs, because sodium and potassium, they are the opposite. So when sodium increase, potassium decrease. When potassium increase, there the sodium decrease. And also development of the hypokalemic alkalosis. So as the potassium is lost through the kidney, for this condition the alkalosis development. And here we can see the clinical feature of the excessive glucocorticoid activity from upward to downward. Baldness and facial hirsutism in female. Buffalo hump, this is the buffalo hump. Development of the hypertension. Why hypertension? Because there is the retention of the sodium and water by this glucocorticoid. Skin thinning, skin become thinning. Easy bruising, that means easy bruising as the collagen synthesis and maturation impaired. Poor wound healing, when there is a wound, there decrease wound healing. Also there is chance of development of the acne. Moon face may develop. osteoporosis and osteonecrosis, increase abdominal fat, abdominal stria, avascular necrosis of the femoral head followed by the fracture of the femoral head, and muscle weakness due to muscle wasting. That means the muscle protein is broken down. Here the another diagrammatic view showing the daily excessive dosing of the corticosteroid in the liver. Here all this condition we can see the increased glucose level, and in the pancreas it increased the glucagon level and it decreased the insulin, and it is responsible for death of the beta cell. So it is dangerous condition. That means when excessive amount of corticosteroid taking longer time, in this condition there is chance of development of the diabetes mellitus. And in case of bones, it increase osteoblast, osteocyte and apoptosis. That means death of the bone cell, and decrease calcium absorption, decrease bone mass, and osteoporosis, osteonecrosis develop, and there is a high chance of development of the pathological fracture. And in the adipose tissue, it decrease lipolysis, decrease adiponectin, increase resistin and leptin, and insulin resistance. That means it acting on the adipose tissue and it develop resistance against insulin. And in case of hypothalamus pituitary axis, hypothalamus pituitary adrenal axis, in this axis what it does, it increase adrenal insufficiency, decrease growth hormone, decrease full body growth. And in case of whole body, what develop, there is the obesity, metabolic syndrome, diabetes mellitus, and insulin resistance. So the most worst side effect of this corticosteroid is development of the diabetes mellitus. So which is not linked to the glucocorticoid, it is the hyponatremia, because in case of glucocorticoid excessivity there is a hypernatremia develop. Other options such as osteonecrosis, it occurs, osteoporosis, it occurs due to high corticosteroid, hypokalemia occurs, that means the reduced potassium level, and growth retardation in the children occurs.